email you? And he saw me yesterday.
No, he texted me.
Okay.
But she's basically, I was like, hey, like, I know that we talked because we talked to the last training that you and I did. And, like, we basically said, like, we wanted to do, like, expectations and, like, make them very clear about, like, when things we did. Like, I look back through PSO stuff and it did say stuff was due 2 weeks before.
That's meeting 2 weeks before.
I know, that's what I'm saying. So we're going to have her come and, like, go over that stuff and, like, kind of help point us
or something.
Well, that's it. So she's coming to kind of hey, and she also said something about wanting to take up an hour.
I think so.
Yeah.
I've been going to a lot of lectures at UPMC and I've been trying to like get people's names so that we can
Can you hear me well? Good. Sorry for delay. We were waiting for 2 more people and they're on the way. But in the meantime, I think we can start the workshop. My name is Murad. I'm one of the second-year neurology residents at the Allegheny General Hospital. I'm one of the volunteers of the Whitetulip Health Foundation in the Pittsburgh branch. And for this workshop, we are working with All for All, which is the immigrant inclusion initiative in Pittsburgh. So I would like to welcome everyone for joining us tonight. And I also would like to thank to AHN, Allegheny Health Network Inclusion Health Track, for hosting us tonight. So this is the second workshop of the 4th series of workshops. It's about cultural awareness in the health system. And the first one happened in August. I will show some pictures about that as well. But before that, introducing the Whitetulip Health Foundation. So Whitetulip Health Foundation is a 501c nonprofit organization, and the goal is to create a network of healthcare professionals who wants to give back to society. So we are trying to create a platform where the healthcare professionals can share their experiences, their ideas, and where they can also provide mutual support and collaborate, and not only their personal passions and skills, but also trying to support the community, both locally in the United States, also abroad. For example, we are making health trips and relief trips to Haiti every 6 months. And these are some of the locations of the Whitetulip Health Foundation. In the United States, I believe there are 25 branches in different states so far. And the All for All, as I said, it's an immigrant inclusion initiative working with in Pittsburgh. And we are very happy to work with them. And they are connecting people, organizations, and communities to actions that build a welcoming and inclusive region. And also through companions and programming around professional development, community engagement, and institutional change across sectors. All for All, I believe it was in late August or September, they did their second annual summit. It was very good. And it had very good attendees from different backgrounds. So this project basically, I will talk about the goals of the project. So it is called Diverse Healthcare Professionals Network that we are trying to increase the diversity in southwestern Pennsylvania. And the second goal is we are also trying to increase the quality of care to immigrants and refugees or minorities in our region. And we are trying to provide this dialogue platform between different groups of healthcare professionals. And the last thing is we are trying to support immigrant and refugee communities with different projects. And I will give some examples of these goals. So we have 2 branches under this project. One is quarterly workshops. As I said, this is the second one we are having now. And the first one happened at Community College at the North Side in August, on August 21st, and it was about connecting the local resources and the healthcare professionals. We were talking about resources here like English courses or like other health groups here in the like free clinics and others. And today we are here for cultural awareness in health systems, and we will focus on what are the challenges for the immigrants and refugees, and what are the challenges of the other side, the healthcare professional who doesn't know enough details about the patients. And the other ones will happen in the upcoming months. One is American healthcare system, and the other one is will be building career in healthcare in the U.S. healthcare system. The other part of the project is individualized support, which is a mentorship program. And on this side, we are trying to give one-on-one mentoring and mentorship opportunities in different healthcare facilities here. And also, we are trying to guide people and we are trying to assist them with their applications and job search. So, so far we have 131 people in the whole network, and we have 15 mentees, and we have 18 mentors in the project. And I will show more details about the website, that you can see the details of the project and how to enroll in the project. So this is that was the first project we held at the community college. And we had 4 panelists. Here was the moderator of the panel, and we have 3 different people. One is from the Islamic community here, ICT. We had 1 guest from Islamic community and 1 guest from the African American community. And here is the website. So I would like to go to the website as well. So this is the main page of the Whitetulip Health Foundation, whitetulip.org, and under the locations you will see a Pittsburgh branch. And I will go there quickly. There are always some technical issues. I won't be able to show that, but basically the website, this is the website interface. So under the Pittsburgh branch, you will be able to see the project and the previous workshops as well. And if you click the project title, you will be able to see the enrollment forms, both for mentees and mentors. And we will be able to see the details. And after getting the details, we are matching the mentees with the mentors in the project. And as the last thing, for the contacts for Whitetulip Health Foundation, we have our intern, Mary, and our email address is pa@whitetulip.org. And for all, Kia is our health access coordinator, and her email address is kia@changeagency.org. So this is the basically introduction of our project. In the next couple of minutes, we will have some experiences of the community members. We have 2 guests. One is Priscilla Gonzalez from Latina Community Center, and the other one is the other guest is Ashok Gurung from Bhutanese Community Association of Pittsburgh. And I would like to invite them to here.
We'll have Priscilla first go, and then we'll have Ashok in a minute. He's parking outside.
And in this part, we would like to learn about the experiences and especially the main challenges in the healthcare system. And if I can transfer the microphone.
Muy buenas noches, mi nombre es Priscila González y ella es María, mi intérprete.
Good evening, my name is Priscila González and I am Maria. I'm going to be Priscila's Spanish interpreter.
Okay. Yo tengo viviendo aquí durante 10 años en Estados Unidos.
I've been living in the US for 10 years.
6 años en Pittsburgh y tengo los 6 años que tengo viviendo en Pittsburgh, estoy teniendo servicio médico. Aquí tienes el servicio médico.
I've been living in Pittsburgh 6 years, and the time that I have spent living in Pittsburgh, I've been taking medical services.
Empecé a tener servicio médico, a necesitar servicio médico por mis hijos, que tengo un niño de 6 años y una niña de 2 años, y es por eso que tengo varias o muchísimas experiencias con el servicio médico.
I've been accessing the medical services here in Pittsburgh because I have 2 kids. My son is 6 years old and my daughter is 2 years old. So I've been giving the medical experience through them.
Mi experiencia ha sido muy buena con el servicio médico en el Hospital Children's, en el Center y en el Square Hill. He tenido experiencias, pero sí ha habido muchísima diferencia entre mi primer hijo y mi segunda niña.
I've been accessing the services and I have had a lot of experiences, but the services have been good with the Children's Hospital and Square Hill, and the hospital right here that is next to us. And the experience has been very good, but there has been a lot of difference between what I did with my first child and with my second child.
La pregunta o la respuesta ¿por qué? Es por yo he llegado a la condición con más experiencias con otras personas. He asistido a diferentes conferencias con más mamás que han tenido experiencias y mi conclusión ha sido la información, es fundamental. ¿Ha tenido mucha experiencia?
I have had a lot of experiences,
pero mi conclusión o el por qué ha sido la diferencia entre uno y otro.
my conclusion and the reason why one services experience has been different from the other is that the information,
El alcance de la información.
how reachable is the information.
Porque muchísimas personas no lo tienen.
Because a lot of people do not have access to this medical information.
Existe el servicio para ver la información.
The service is there, but the information about those is not.
Y eso fue con la experiencia de mi niño, súper muy bien, y con mi niña también. Pero con mi niña, como yo tuve ya muchísima experiencia en pedir información, he asistido a conferencias, eventos, es muchísimo mejor el alcance que uno tiene o los beneficios que uno tiene cuando está informando.
So the services has been very good with both of them. With my first kid, it went well. With my second child also, but the difference is the information that we have accessible as part.
Y también tengo que informar, o quisiera informar las experiencias de muchísimas mamás que soy su voz ahora, que me han dicho lo mismo. Concordamos en que saben que existe, pero ya tarde la información. ¿Sí?
And also I would like to voice some moms friends that I have that they have told me that the information, they know the information is there, but they don't know how to access those information.
Mi conclusión es eso, que necesitamos más acceso o más información a todo lo que hay, a todos nuestros derechos, que tengamos alcance, que sepamos que existe muchísima información que tenemos, muchos derechos que tenemos.
Yeah, so my conclusion is that we need to have access to that information. We know that we have the right to access those information, but most people don't know about it.
Muchísimas gracias.
Thank you very much.
¿Alguna pregunta o one question?
Anybody has any questions?
How can we improve if she has any, if there are any things that she thinks that would have helped her during that experience? How can we do that if she hasn't learned this? That would have helped.
For people to know more about this,
Yo pienso, bueno, nos ha servido en la comunidad hispana que haya más programas, que haya más acceso a programas como posparto, preparto, información que nos digan que existe. Simplemente que saben, hay personas que no saben que existe el teléfono azul. Eso es algo tan esencial que no saben muchísimo más que existe.
so I think that we have to access information through programs, and that has to be reachable to the community, to the Latino community. And for example, the blue phone is something that most people don't know, but it's something so basic that everybody should know.
Ahorita simplemente, yo el tiempo que estoy aquí, son 5 años, y solamente he sabido de 2 programas que existen en español.
So from the time that I've been here, it's been 5 years, and I only know about 2 programs
En español.
in Spanish. In Spanish.
Usted mencionó estas conferencias de mamás. Estoy interesada en saber más de cómo estaban estructuradas y cómo funcionaban.
Sí, de hecho son, bueno, se llaman, los coordinan tanto Centro Latino Comunitario como Centro Latino Familiar. La última lo tuvo Centro Latino Comunitario. Ahí le podemos dar cualquier información. Está coordinado por Ángela Pegarano. Ella es colombiana. Es una persona que está muy pegada a la comunidad latina. Y es lo que es preparto, posparto y existe un programa muy bonito que es la lactancia y eso atrajo a muchas mamás que estaban interesadas. Fue como un mini curso que ella también
Can we have some of that or the question as well? What was the question?
There is a program. The information can be obtained in the Latino Community Center.
I'm so sorry, can we get the question first? What about the question?
The question was, she mentioned the mother's conferences, and I was interested in knowing a little bit more about them and how they were structured.
So you can get the access to the program through the Latino Community Center. So the money was given in order for this program to be given through the Latino Community Center and hand in hand with the Latino Family Center. They both work together. They did the postpartum, pre-birth, I mean, birth.
Y un programa muy bonito que fue de lactancia, como
And a nice program that was about breastfeeding
que trajo muchos más.
that brought together many moms.
Y fue muy importante porque mamás creciendo, mamás seguras y verdaderas,
And it was very important because it brought together moms that were mom for the second time.
no sabían cómo dar.
They didn't know how to breastfeed their babies. So this program brought a lot of community members together, and it was a very important one. If you would like, at the end, she can provide you the number.
If there's no other questions, we go to our second class. Can you introduce yourself and then can you talk about like what were the main challenges that you faced?
Hello. First of all, sorry I was too late today. My name is Ashok. I'm from Bhutan. Actually, I left my parents when I was 11, and after that I came to Nepal as a refugee. And then I was not allowed to register in the refugee camp because I was a minor. So, and I had to find somebody to adopt me as their son and to get registered. So that's how it happened. And fortunately, I had my own uncle who left a little bit earlier and was registered. Like he took me as his eldest son, increased my date of birth, and made his son. And after that, I got registered in the refugee camp. And then after the stay, 16 years in Nepal, I was here in 2009 in June. Resettled through the Jewish Family and Children Services at that time, now called as the Jewish Family and Community Services. Initially, for the 8 months, it was so kind of wonderful because there was Medicaid, everything was provided, and also the resettlement agencies were very, very helpful. There were 3 different resettlement agencies, and we were getting some kind of information from one way or the other, not only the Jewish Family and Children Services at that time, but there was also Catholic Charities and also Northern Area Modern Services Company, which came a little bit later than 2 of those resettlement agencies. So after we came here, I actually had quite many health problems of my own. I was going through a lot of anxiety because of my childhood difficulty, and also like even being in the refugee camp, I was trying to go to school, so I had a college degree, but after I came here, I had a lot of problem understanding English. It was quite a difficult thing, but the good thing is that we had interpreters available initially, and later I thought, okay, it's a good one because I was getting quality services from the hospital because I can understand through interpreters. And I felt like that's a cool type of job, and I later became an interpreter in the language line for almost like 7 years. And then by this time I was working, going to hospital, and also going to school, and it helped me a lot. Regarding the health system, for me it was kind of okay because I was able to understand some part of, initially like I had some little English, and later I was improving. But for my in-laws who live with me now as my parents actually, and they had a lot of problems, and also the community at the same time. That's why we co-founded Bhutanese Community Association Pittsburgh. We work with a lot of local partners here around. We have the 3 resettlement agencies, Department of Health and Human Services. Also, like we have a Pittsburgh Health Center, who has been providing a lot of different language services. We feel like there should be many Pittsburgh Health Center here. They are providing a very tremendous, the helpful services there. There are staffs from different communities so that they can be directly helped. They can understand the culture, I had once heard that sometimes they have the Bhutanese Nepali, it's a syndrome, meaning like they have a lot of pain in their body, but when the providers, especially the health professionals, try to screen them, they do not find anything. The problem is they have a lot of mental health issues. Like I said, I myself confessed openly to you that I had anxiety, but I have been able to control it because I did a lot of things. I do meditation, different kinds of yoga, aerobic exercises, and try to keep as fit as possible. But all these ideas are, I think, not there in our community people. So we had a community organization, and we work in a group, and the local partners were very, very helpful. And I think it's one of the most important things is that I think the community needs to come together first. And when they are organized, work together, hand in hand, join together, and if they, I think, ask for help in the local communities, they are always ready. And with their help, we were able to get different grants from the Office of Refugee Settlement for 3 years. I think we got around like 500 and some 40,000 from there. So for 3 years we had 180,000 per year. Also we had a grant from Jefferson Regional Foundation for 2 years regularly for $50,000 or something. And later, like when we had the Office of Refugee Settlement grant was over, then the organization was having some challenges to sustain it. Again, then the Jefferson Regional Foundation came, and they are helping still. The other things that we have is smaller grants like from Action Housing, from Vibrant Pittsburgh, they have mini grants they started. So nowadays, like we have a quite big community in the South Hills. Especially we gather a lot, like in a big number whenever there is some kind of funeral. What had happened actually was, initially the Vibrant Pittsburgh was the first organization who provided us with the 5,000 grant per year. And with that, what we did was, we started a robocall system. We have now 650 different family households number. So when we have to say, let's say, whenever like when the people have to, like, especially in the winter, when the school is delayed by 2 hours, people don't know and they go to school and keep waiting. But what we did was, with that grant from the Vibrant Pittsburgh, we had a robocall, and after that, our people who are at least like good in understanding English, and our community leaders and volunteers, what they did was, they picked up the niche and used to put in the robocall, stating that, okay, the Whitetulip School is delayed by 2 hours. So, and they used to give the name of the schools, so that people used to get the information like that. So in the funeral also the same thing happens. Whenever there is somebody does in the community, then they put in the roll call, and they're really like hundreds of different cars, and it's so difficult for the funeral home to withstand the crowd. But this community come together, which is one of the positive aspects that I would say, and we've been helping each other. And unfortunately, we still have not been able to address one thing, that is mental health problems, and especially the winter is quite not good because people don't get. I think people are not used to with this kind of climate condition first. Second, we have a lot of SAD, that is seasonal affective disorder. I think just because people get inactive, people don't get enough sunlight, and people don't. Here people take vitamin D, but our people don't do that. And they are kind of, especially the older generation, they try to remain at home, homebound sometimes, and they get a lot of health problems. And sure, thank you. Yeah, I was able to focus.
Yeah, short of that, getting through on time. So, is there any particular question? At this point, we can get it. And then after we have a small exercise. So, is there any questions?
So I'm curious about your experience from when you went from your 8 months of benefits to not having that benefit anymore, and what the transition was like. Maybe
Sure. The first thing that I was trying to look for a job. Initially, I did not take the. I was kind of arrogant and not taking the entry-level job initially. And my wife started working, and from her employment, I was actually covered. And for my in-laws who are over 60s, they were. My actually mother-in-law tried to work for about 2 months, and after that, she was laid off from the employer because she could not keep up the level of work she had to do. And because of that, she got laid off, and with that, she also got a letter, and we went to the, again, welfare, and they provided with the medical assistance.
Any other questions?
I mean, just in general, is there a website or something that has all these resources that are available in Pittsburgh for patients? I'm coming from Forbes, Monroeville, so I'm on the east side of Tunnel. And I had no idea we had all these communities and all these resources that are available, so I'm just wondering if that's something that is available for us to use, so I can at least give my patients information.
I have not, I'm not sure exactly sure that whether we have that sort of a website that informs everything, but surely I would recommend the resettlement agencies plus the Department of Health and Human Services in downtown. I think they can provide a lot of information.
So thanks a lot for joining us. It was a great contribution from both of you. And the next step is I would like to introduce Dr. Taylor. Dr. Stephanie Taylor with medical degrees from University of Pittsburgh School of Medicine and residency training from University Medical Center Jacksonville, Florida. And she has been a member of Diagnostic Pediatric Group since 2007, and she has been involved with medical education since her arrival. She's now serving as the program director for the pediatric residency program at Children's Hospital of Pittsburgh of UTMC. Other than English, she also speaks Spanish, correct? Okay. Please join me to welcome her.
Hello, good evening. Thank you for inviting me. I feel very fortunate to be here to share a little bit of my experiences at Children's and to help to moderate the next group of speakers. I also feel very fortunate because I'm from Pittsburgh. I was born and raised in McKeesport, and so this is my home. My husband and I met in medical school here in Pittsburgh, but unfortunately had to leave this city because he had an obligation to the United States Navy, and they take those very seriously. And we have a lot of things in Pittsburgh. We have, great food, theater, sports, what have you, but we don't have a Navy base, which is why I ended up getting my training in Florida, and then subsequently relocated to Youngstown, Ohio. So we were gone from Pittsburgh for 21 years and just came back in 2007. And this is a place that when you're from here, you sort of think it's really a great place to live and to grow up. And then when you live elsewhere and then you come back, it's reaffirmed that this is really a special place. And I'm happy to be able to be back here in Pittsburgh and to be at Children's. I think the reason that I was invited to chat with you was to talk a little bit about our experiences at Children's. My clinical role is that I'm a pediatric hospitalist, so I take care of children who are hospitalized, not with specific subspecialty diagnoses, so not children with cancer and not children with diabetes, but general medical admissions like pneumonia, asthma, that sort of thing. And so I meet a lot of different patients and families from not just the Pittsburgh area, but from the surrounding area. And the thing that I have noticed since returning to Pittsburgh is the large number of immigrants and refugees that we are supporting in this area. It's really quite impressive, and it's not something that I remember about Pittsburgh growing up. So it does make me proud to be from here, to know that this is a place where, you know, we include other communities. And the comment about the blue phones are indispensable, depending on where a family is from, to be able to communicate with them. So it's been wonderful in that regard for me, you know, professionally. My other role is that I'm the program director for the Pediatric Residency Training Program. And what that is the 3 years of medical training after medical school. And we have a pretty large program at Children's. We have about 120 pediatric residents in all. So it's a fair number, yeah, I know. I have 3 children and I have 120 other children at Children's that I have to keep track of. But it is a large number. It's very overwhelming at times. But one of the things that we recognized was that we did not have a diverse residency training program. Our residents did not look like or talk like the people that we took care of. So in the past 5 years or so, we've made a very concerted effort to recruit a more diverse group of residents, which we have been able to do that. I'm very happy to report that we've been very successful. Pittsburgh is a very welcoming community. We have, you know, people who train here that are from here, and we also have people who train here who are from other, you know, cities, states, and countries. So it's wonderful to see that we've been able to diversify. The unintended experience we didn't expect was that some of our trainees have experienced some bigoted and negative kind of hateful conversations from patients and families who are